Good afternoon. I think we're going to get started. Is this on? It doesn't sound that loud, but I think St. Luke's, can you hear us? Yeah, okay. Hi, my name is Vicki Sharp, and I'd like to welcome you to the third annual Dan William Award, where we give an award to that House staff member who best personifies the characteristics of Dan as a physician. Back in the dark ages before I went to medical school, the tradition was that physicians played golf on Wednesday afternoon. There were also a group of physicians who did something else on Wednesday afternoon, and that was they volunteered. They volunteered in places like Planned Parenthood and free clinics. When I got back from medical school, and I went abroad, so that's what I mean when I say came back, that tradition had really disappeared. I think doctors still played golf, but they didn't volunteer their time anymore in free clinics and Planned Parenthood, except for one physician, Dr. Dan William, who I met when I was a PGY2 here in the very early days of the AIDS epidemic. And then I got to know much better when I came here in 1997, and I found Dan volunteering his time in the Samuels Clinic, which he did from about the mid-'80s to 2001. Dan received the first St. Luke's Roosevelt President's Award in 2002 for his outstanding contributions. You're going to hear more about Dan from his partner and from some of his colleagues today. And as a way to introducing those people, he's not on the program, and he describes himself as un grand emmerdeur. For those of you who speak French, and those who don't, I won't translate. Dr. Gabriel Sara wants to say a few words. So, Gabriel?
Thanks, Vicky, for introducing me. I came, I think, at every one of those awards, and it's a special joy for me to be here talking about Dan and being with Dan. I always say that I love this picture because I feel that he's with us when I see it. And what I would like to say that I was one of the few lucky people in this room who worked with Dan William. And I was just starting attending here when I met Dan, and I learned so much from him, so much medicine. It's just unbelievable the way he would take care of his patient. And I could talk a lot about him, but I know that there's little time. So I chose to speak about one thing, one major quality that he had, which I really this morning realized, well, what were the secret for Dan for being such an amazing clinician and caring doctor? The most important thing, I think, that Dan is a listener. Dan listens. And listening doesn't mean, shut up and let the other person talk. Really listening the way Dan does it, I never asked him, but I'm sure this is what he did, is that he is with the patient. He listens, he doesn't talk, he lets the other person speak, but the other person feel so cared for, so loved, that they will say things that they would not say to another physician. And that's what gives him the clues for making a diagnosis, is listening first. The other thing that happens, and I would say I experienced this personally, and I hope that you will all experience this as doctors, if you are really with the patient, present to how they feel, you will hear things that they didn't tell you. I sound like a weirdo when I say that, but this is really true. You will hear things that they are feeling, and sometimes they're not aware of their own feeling. And while you're talking, you will talk about it, and they will be really, they'll say, well, you're right, this is how I feel, or that I have. So the listening is something that is really a quality that It's hard to acquire upfront, but you have to be aware of it to acquire it. So he was an amazing listener. That's what I can say. I can say many more, but that's what I would say for today. The important thing today is that we are going back to the dark ages. You said in the dark ages, forget it. We are going back to dark ages now. Okay, and you're experiencing it with the computer right now. While I love computers, and I learned computers from Dan, who was an expert before anybody else was. I think things have changed, and now the computers are controlling our mind and our practice and our daily life, and I hate that. And I think this is a big danger that you're going to lose the skills of being a good clinician. So that award is becoming more and more important to get, because you need to remember you have to forget the computer to be good doctors. You have to use them because it's practical and convenient, but they should not be between you and the patient. And I find that the more we are computerized and the less we're listening. That's why you have to remember, you have to listen. You have to try to make this machine be away from you so you are with your patient feeling very strongly connected. So that's what I can say about Dan. I'll always say something about him because I can talk forever about Dan. I'd like to introduce Bob, who's a friend. And actually, Bob, I knew him for years and years, and I knew his voice on the phone. I knew immediately it was Bob on the phone. We had always phone calls referring patients to me and me calling him back. He actually is Dan's partner and ran his office, probably the most efficiently run office in New York with Bob. And we met after actually Dan passed away. And then it was really, I immediately loved Bob, and we really connected instantly. So I'm very proud to be the one introducing Bob, who was behind this award, with Dan's family, of course. And so Samantha, you have a very important thing in your hand today, because you're responsible for this award. You're responsible to continue being a Dan William kind of doctor, and then also make sure that everybody around you try to do the same thing. Thank you.
Well, thanks, Dr. Sarah. I always appreciate your words of wisdom and your caring words for Dan, so much appreciated. And I have to apologize that I'm not a great speaker, so I do speak from notes, but I hope that will be okay. It is always a pleasure to be here at this awards ceremony, and again, I want to thank Dr. Sharp, whose sponsorship of this award is why it's here, and to Joe Trapani, who did all the coordination of this award luncheon, so thank you both. We're here both to retrospectively pay tribute to Dan Williams' medical career and to look ahead to the careers of the young physicians today who are here but whose careers are just beginning. Dan graduated from medical school in 1972 and trained at Manhattan's Veterans Administration Hospital and at Bellevue. He began his private practice in 1976 and for several years also worked for the New York City Department of Health, focusing on sexually transmitted diseases. He co-founded the Gay Men's Health Project, a free STD screening facility, and volunteered to treat patients evenings at a free clinic. In the very early 1980s, when he noticed symptoms of a new illness in his established patients, which of course was HIV, he worked tirelessly to try to unravel its etiology, to find therapies for his patients, and to learn how to interrupt its transmission. Dan's association with Roosevelt Hospital began in 1980 and lasted until his death in 2008. Besides admitting patients, he helped organize and initiate the Samuels Clinic, as you have just heard, and volunteered his time there every Wednesday afternoon until his retirement from medical practice at the end of 2001. After his retirement, and as a volunteer, he continued at Roosevelt interviewing prospective intern applicants, doing teaching rounds, and instructing second and third year medical students in both the science of medicine and in his own special art of communicating with his patients and putting them at ease. So for those of you attending this awards ceremony for the first time, these are some of the values that we're celebrating and some of the highlights of the career that we're remembering. The qualities that Dan William brought to his interactions with individual patients, his love of teaching, his commitment to pass on his knowledge and expertise to younger physicians, and his willingness to volunteer his time are what we are remembering today. He made a big difference, but all of you who have chosen medicine as a career have in part done so because you want to make a difference, both to individuals and to the greater arc of humanity as well. Let this award and the retrospective of Dan's career serve as an inspiration and an example of how any individual with strong motivation and high values can affect positive change. Our speaker today, Peter Staley, is also a person whose imagination, talent, and perseverance has significantly altered the way HIV disease is regarded by the public, by the medical community, and by the government. Peter's activism is particularly focused on providing access to new therapies for HIV-infected people. His activity was recently chronicled in the 2012 Oscar-nominated documentary, How to Survive a Plague, and he is also the founder of AIDSmeds.com, an educational website for people living with HIV. And he was Dan Williams' patient for many years. Peter.
Thank you. In Camus' The Plague, the doctor gets into an argument with a friend about the existence of God. And finally, in exacerbation, he says, "Yes, you're thinking it calls for pride to feel that way, but I assure you I've no more than the pride that's needed to keep me going. I have no idea what's awaiting me or what will happen when all this ends. For the moment, I know this: there are sick people and they need curing." End quote. Now, I have no idea if Dan William believed in God. I consider myself a humanist with an abiding belief in our innate but all too often unused abilities to love and to be selfless. Dr. Dan William, my doctor during the plague years, was a shining example of humanity's best, tapping reserves of love and selflessness year after dark year. I found him, like many did, in the early 1980s. I was a relatively new arrival to New York City, young and deeply closeted. He was the openly and comfortably gay doctor on West 57th Street that hundreds of us found just by asking a friend or two. We only wanted health care without judgment. Better yet, we wanted health care with empathy. By the time I was diagnosed with what was then called AIDS-related complex in the fall of 1985, it would now be called stage 3 or symptomatic HIV infection, Dan's office was already under full assault from the plague. By year's end, there were 15,527 cases of AIDS reported in the U.S. since the crisis began in 1981. And there were 12,529 deaths, a death rate of over 80%. By 1994 and 95, over 50,000 Americans were dying each year. In New York City, 8,000 residents were dying annually at the plague's peak. In the early years, hospitals were overwhelmed. Some patients would die quickly from PCP pneumonia on beds placed in hallways because rooms were all full. Even though epidemiologists had quickly pinned down exactly how HIV was spread, a toxic combination of fear and bigotry often crept into our healthcare settings. Hospital meals were left undelivered. Bed sheets were left unchanged. What amazes me to this day